Hi, I'm Trevor Sawallish. I'm the Vice President of Operations for Physician and Ambulatory Services. As I mentioned in my first video, I'm going to be providing quarterly updates as to how we're doing as a medical group and highlight some areas that we are succeeding on, some areas that we have to improve, and give you some updates about what's going to be coming up in the quarter ahead. I'll also issue a quarterly challenge, like I said that I would do. So let's jump in. As always, let's start with a reflection. I have a couple of quotes I'd like to share about the importance of continuous improvement. The first one comes from somebody I hope you recognize, Benjamin Franklin, one of our founding fathers. Without continual growth and progress, such words as improvement, achievement, and success have no meaning. Then we have a second quote, a little bit closer to home, and a little bit more recent. Perfection is not attainable, but if we chase perfection, we can catch excellence. Vince Lombardi. And I think that's the perfect quote that leads us into an update on our scorecard and how we're doing as a medical group. Like I said, we'll use these quarterly updates, hopefully briefly, to share how we're doing against some of our key performance indicators and to highlight a few areas of success as well as a few areas that we have to work on as a group. First, I'd like to point out a few things that we're doing well on. Exceptional work on our net operating income. Our ability to be here for patients and continue our mission requires that we meet our financial objectives. Despite a slow start in the beginning part of the year, we have really been doing well, especially on a care delivery perspective, in achieving our budgeted net income. As you can see, we are not only seeing many patients, but we are managing our expenses very well. And through the month of June, we have achieved a net operating income of $20.5 million. Now that's without Dean Health Plan or the Dean Health Plan risk pools, but that far exceeds our budgeted loss of $38.4 million. So really, really great work for everybody who's been participating in managing expenses and making sure we're seeing all the patients that we can. We continue to do very well in our overall quality bundle. You can see here the quality bundle includes hypertension, diabetes, colorectal, breast cancer screening, influenza immunization, childhood immunization, and all-cause readmission. Across all of those, we are meeting our goal. We're at 74.6 versus 73.9. We continue to do well because in many areas we are exceeding our goal, being exceptional in hypertension, diabetes, and colorectal cancer screening. So really, really excellent work there. Breast cancer screening continues to be one that we continue to struggle with, but as you can see, the green arrow there represents that relative to May, we actually increased that score, and I have a lot of great activity going on to try and bring that in line. The immunizations will probably continue to be challenged, and certainly readmissions is one that we continue to focus on, but not doing as well. We have also shown significant progress in our screening for depression. You can see here we have achieved for the first time in the year our minimum result, hitting 63.75. This was truly a great team effort on the part of the IHT team, getting our EPIC tools all aligned with the measure, and then all of our operational teams to ensure that we are integrating depression screening into every area in the medical group. So really exceptional work. The progress is clear and it's paying off. So thank you so much. We do have some areas that though we have to continue to focus on and have some opportunity to improve on. The first that I would note is we have had a slight change, negative change in our willingness to recommend. So you can see here that that declined a little bit from May. So certainly an area we want to focus on. All-cause readmissions as part of the quality bundle, that went one more month in the wrong direction. We saw a slight increase to 10.2. Our hope is on the medical group side that we can get all patients coming out of the hospital in as quickly as possible so that we make sure that we are managing them to minimize the risk of being readmitted. And lastly, access is another one that you can see we saw a little bit of a decline, and we are hoping that that continues to get better as we add some capacity over the summer months. But clearly, as patients have started to come back after the pandemic, or at least as we've normalized a little bit, we've seen a lot more patient demand, and therefore our accesses have been a little bit more challenged. It's another area that we will continue to focus on. Overall, though, what I want to say is if you note the change from the prior month, we have had 13 of our 17 measures improve in the last month, and many of the same ones over the last quarter since I've updated. So really tremendous work, and thank you to everybody. I did want to share some things that we're going to be talking about in our upcoming town hall. This is our agenda for the third quarter of the year, some major efforts that are going on. Our 2022 planning continues. Our primary care compensation model continues to be refined and rolled out here in the next few months. We'll be hopefully finalizing plans for that. South Madison campus will be going live in the first part of the year, and a lot of great operational work going on there. Monroe is working toward their Epic conversion. We have a new finance and supply chain system that's going to be put in starting in November, and work continues on that. And certainly we will be talking more about the My Voice survey results. Again, we'll share more details on each of these at our upcoming town hall. And as I mentioned in my first video, I always like to issue a quarterly challenge. And as I mentioned, we saw a little bit of decline in our willingness to recommend. And really what I want to focus on for my quarterly challenge this time is pay attention to our patients. We all get very busy, especially as more and more patients come in. It's very easy to just start getting in the rhythm of our routines and our workflows. But really think about our experience for our patients and pay close attention to not only how patients experience us, but then look for simple ways that we might be able to make their experience better. That might be something as simple as make sure that you are greeting and smiling at your patients every single time. It might be something that you work on as a team together. But for this quarter, I'd love the whole team to really pay attention to how our patients experience us and where we might be able to do better. Like I mentioned, we've got town halls coming up. The first one is on Monday, August 9th from 11 a.m. to noon. The next one is on Thursday, August 12th from 7 to 8 a.m. Really look forward to having you all participate in that, not only so we can give you a few more detailed updates, but also you can ask questions of us and we can make sure that you've got all those questions answered. And if nothing else, it would just be great to see everybody and hear from everybody to continue the discussion about how we're doing as a medical group. Thanks for listening to the video. Thanks for staying informed. If you have any questions, please feel free to email me at any time, but also look for those town halls where you can ask questions and we can continue the discussion. Thank you so much.